Greetings, Internet people. My name is Brandon, and I am a family practice provider with Revital Health Clinics. We are the premier hormone replacement therapy slash wellness clinic slash age management medicine clinic for men and women here in the Middle Tennessee area. Today, we're going to be doing a video about testosterone replacement therapy in men. Women can also have replacement therapy with testosterone at a much lower dose, but today's topic is going to be about men and testosterone replacement therapy. A little bit about myself. I am a family practice provider. I've been practicing for about 9 years now. 7 of those years have been mainly in hormone replacement therapy. I have a lot of experience with men's health and men's hormone replacement, such as testosterone replacement therapy. And we have a philosophy here at this clinic that is a little different than many doctors' offices when it comes to replacement therapy. And you can find out more on that on some of the blogs and reading throughout the website. We think it's the best way to go about replacement therapy. All right, so let's jump into things. We're going to be talking about diagnosis of low testosterone, also called low T, and the medical term for that is hypogonadism. Hypo meaning underactive, gonads meaning, in this case, testicles. A quick note for any medical providers, whether that's a physician or a mid-level, such as a nurse practitioner or physician assistant, a good primer on diagnosis and management of low testosterone is the Endocrine Society guidelines for TRT in men. They were recently updated. I was looking at them a little earlier today. They were updated in 2018. Previous to that, it was a 2010 update. The word guideline, I think, is good for me just to mention very quickly. It is just that. For the novice or someone who's not well versed, if you follow the guidelines, you'll tend to stay out of trouble. But for someone who's a little more skilled and has done it for a while, the guidelines can be restricting, and so they're exactly what they say they are. They're guidelines. I watched a video from the 2018 conference the endocrinologist had, and the speaker even makes a note about that they're guidelines. They're not set in stone. But for new people, it is a decent primer. So when we talk about diagnosing low testosterone, we are typically talking about two things that need to be met, two needs that need to be met. And what I'm saying here is the conventional medicine, conventional medical wisdom. And I'll circle back to that periodically and in more videos for sure, because there's conventional medicine and there's I guess non-conventional, or what I would call functional or wellness medicine. A term that I've heard that I like is preventative endocrinology. So conventional medicine says for diagnosis of low T, you need two things. You need a low testosterone level, and you need symptoms. Okay. The low testosterone level needs to be in the morning. typically before 10 a.m. On 2 different occasions, and the person should not be sick or had a really rough night the night before. Maybe they're hungover or they got 2 hours sleep. You do not want to test a guy under those scenarios. His levels are likely going to be lower than normal. And the other one, so there's lab testing, and then there's symptoms or signs. And there's a long list. There's more specific signs and symptoms of low testosterone, and then they become less specific. They're also categorized as primary or secondary symptoms. And the Endocrine Society recommends that someone have a certain number of primary and a certain number of secondary symptoms. The secondary symptoms most people have heard because low T has become a very popular thing. And they are less specific, and those are things like fatigue, weight gain, moodiness, irritability, depression, loss of focus. All right, first let me just apologize for the crappiness of the video editing. This is my first video, and so it's not perfect or even close to decent, but bear with me. I wanted to come back in and make a quick note about some of the signs or symptoms of low testosterone in men. I mentioned the less specific ones mainly because that's what you will tend to see or what people tend to present with. And that may be partly because it has gotten, the term has become a lot more popular, and there are advertisements and clinics just like mine that try to, I guess, advertise their services or their expertise. But often it's going to be the person coming in with the less specific complaints that I mentioned. But there are more specific complaints. At the top of the list are things like what the Endocrine Society calls a delayed or incomplete sexual development. Basically, the guy that comes in and says, you know, I never really had a lot of facial hair or pubic hair, or as of late, he said, you know, I'm starting to have a decrease in underarm hair, pubic hair, facial hair, or the guy that kind of has body proportions that seem smaller, or he looks very frail. His body composition is such that he looks as if muscularly the development was not normal. And that can be hard to tell, honestly, if somebody just is that way, or they've never really had an interest in being stronger or fit. But those are some of the more specific ones. Testicular size is something that's notable. Typically, I think what's listed is less than 6 cc's. Most of us aren't going to be measuring testicle size. Some do, but certainly if the testicles are very small, the first question is, have they always been that way? And the guy may have no clue. But that's one question. Second question is, if they haven't always been that way, when did you start noticing them getting smaller? You might see a guy who comes in and says, yeah, over the past few years, I've definitely noticed they've shrunk. That's a pretty specific symptom of sign, not symptom, sign that low testosterone needs to be very much considered. And then somewhere in between the very specific and lowest specificity are things like the sexual signs and symptoms that people often will think about with low T. Low sex drive is one. The guy will have little to no interest in sex, and that can often cause problems with his significant other, as you can imagine. Vice versa, we would feel the same way. You know, what's going on here, and your mind can get carried away. And then also erections. Erections may not be as strong. Morning erections may be a lot less frequent or absent. Those are things that should raise your antennas to look at low testosterone levels as a possibility. So I just wanted to kind of throw that in there. All right, let's pick this back up. I find myself checking to see how I look, because my wife often will make comments that I look like I just rolled out of bed and threw scrubs on and came in. And maybe that's because it's exactly what I did. Okay, so I'm going to go back and forth, and hopefully it's not too confusing on, and let me back up a little further. My hope is that this will be helpful and informative to medical providers and patients alike. Okay, so that's number one. Number two, I'm often going to go back and forth between what conventional medicine says and what wellness or optimization of hormones would say. Okay, so we were talking about diagnosis a little bit. When it comes to conventional medicine, and any medical providers are aware of this, who are practicing at least, insurance companies dictate how well you do, what you get paid. Okay. They also dictate what a patient can and cannot have. I have heard rumors of times of old, the golden age of medicine maybe. Physicians and practitioners that are older than me can speak to this, where there was a time where the insurance companies were not so involved, and you could do what was best for the patient. You didn't have to jump through 15 hoops to get the medication you wanted, or the procedure you wanted, etc. And I'm sure there's a flip side to that as well. Okay, so insurance companies dictate medical necessity. Okay, so when a patient comes to see you and you have a suspicion that maybe they have low testosterone, the insurance company is going to dictate what is medically necessary, or if the diagnosis that you're giving meets their requirement for reimbursement. Okay, typically it's going to be a total testosterone level less than 350 or 300 in the morning before 10 or 11 a.m. Every insurance company could have different standards, but in general, that's what you're going to find. If you test before 10 a.m. and it's below 300, 9 times out of 10 you're going to be safe. And that's 2 tests on different days when someone's not sick and ideally fasting. Okay. So you have to meet their requirements for medical necessity, and if you meet those, then they will then reimburse for treatment or therapy. Okay. So it depends upon if the patient's using insurance versus not using insurance. It is not uncommon to find someone who is borderline. They are routinely, 380, 420 on their total testosterone. The good news is that most of the time, if the insurance company will accept a free testosterone level, then if it's in that 350 to 450 range, 300 to 450 range, many times that free testosterone level will be low. Not always, you'd have to check it, but it often will be low if it's borderline low on the total testosterone. And insurance companies keep different cutoffs for what they consider a low free testosterone. Often 10 nanograms per deciliter is considered the cutoff, but not always. Sometimes it'll get as low as 6, I believe. Aetna will use 6 if you don't have a reference range from the lab that you ordered it from. And we can get into a little more later about lab ordering and those types of things, which labs to order, etc. So that's insurance-based, going down the insurance road. The other road to go down is somebody is not using insurance or they don't have insurance. You've got a little more freedom in those scenarios. At that point becomes a lot about the provider. What is his or her comfort level and viewpoint on low testosterone diagnosis and treatment? I am of the mindset that optimization, and it's not just me, by the way, there's plenty of others out there. I guess I'll throw a shout out there to WorldLink Medical, which is where I've gotten the majority of my training done. And it's been eye-opening, to say the least. Much of it is as I diverge, much of it is the literature review. You find articles and things that are very interesting that really start to make you think and question conventional practice. So I am the mindset that optimization of hormones, bioidentical hormones, can be a very big boon to health and help prevent disease. And there is quite a bit of evidence, good evidence, to support that thought. So depending upon the provider that you're seeing, if you're not using insurance, there is a little more leeway on whether or not they can treat you. Someone in my lane is likely to treat someone who is low normal, with signs and symptoms of low testosterone. And even, this is a topic maybe for another time, but even without a lot of signs and symptoms of low testosterone. And the quick thought process on that is, even without signs and symptoms, there's still long-term risk, or the potential for long-term risk for disease, often secondary to loss of muscle mass and then an increase in fat and visceral fat, specifically, which is the worst of the two. So depending upon who you're seeing, if you're not using insurance, there can be a little more leeway. So let's go back to diagnosing. So you've got some lab work, you've got some signs and symptoms, more than likely, and you decide to start treatment. Going back a little bit, the reason for the morning tests is that testosterone levels do have a diurnal pattern throughout the day, at least for the vast majority of men. They're highest in the morning, and then they get lower as the day goes. So if you want to see what the levels are at their best, you want to test in the morning before 10 a.m. ideally. 10, 11, it's not going to be a huge difference, but ideally before 10 a.m. is good. As we get older, that difference between morning and evening starts to diminish, whereas in many 65, 70-year-olds, there's not going to be a huge difference between 8, 9 a.m. and 3, 4 p.m. Um, there can be, but it is not near as likely as someone who is 25, 30, 35. Um, so that is the reason the Endocrine Society and other experts and insurance companies require morning testing. They want to see what it is at its best. They do not apparently care if it's low after 10 or 11 a.m., which seems a little odd to me. I don't particularly care when your levels are low. If you've got signs and symptoms, especially, and your levels are technically above 300, 350 before 10 a.m., but after 10 or 11 a.m., they lower and you have signs and symptoms, I don't see the sense in not considering treatment of that person once you've ruled out maybe other more common things. And we can talk a little bit about that real quick. So typically when you go in and see your primary care doctor, internal medicine doctor, whoever, and you complain of fatigue, we do a few quick things. It's kind of a laundry list. You get a little info about how long has it been going on, describe it. Of course, what medications are you taking, anything new, and then you do some labs and physical exam as well. Don't want to discount that. Maybe you catch some kind of arrhythmia when you're listening to their heart, which could easily explain some fatigue if they're not getting good pumping function, or you hear something or feel something. You hear something in the lungs or feel something in the abdomen. So you definitely do those things. And then you do a few labs. You do what's called a CBC, maybe to look for anemia, which would be rare in a man. But if found, it definitely needs to be looked into. You do a very basic thyroid check, which most of the time can help you catch a glaring thyroid issue. Often, if that thyroid is normal and nothing else jumps out at you, maybe you should do a few extra thyroid labs. And the normal test that's done for thyroid is just a TSH. It's not actually a thyroid hormone. It's a thermostat, essentially. It's a pituitary hormone that tells the thyroid to make thyroid. So you do the TSH, you do a CBC, you do a CMP, which is a chemistry panel. Look at electrolytes, look at your kidney function, look at your liver function. Depending upon the age, maybe you screen for cancer. Maybe you do a PSA test. If they're a smoker, maybe you consider doing some other imaging or testing. And hopefully, if you're 30 years or older, and I know that seems young, but it's not going to hurt to check. You check a total testosterone level at the minimum, and ideally you check a total and a free testosterone level. Often those are not done. All those come back normal, and they tell you that everything looked good, not sure what's going on. Exercise more, try to eat better. If they look like they're at risk for sleep apnea, maybe get a sleep test, which is a great idea. I'm not discounting that. That's something I definitely think about when we see people with so-called unexplained fatigue. How are they sleeping? What do their hormones look like? What medications are they taking? Diet is huge. But often everything comes back normal, and they say, maybe we need to get a sleep study. If they don't say that, they often say, everything looks pretty good. I'm not sure what's going on. If you're lucky, they maybe try to send you somewhere else to get get another second look, or tell you to come back in a few months if you're still not feeling great. If you're not that lucky, they tell you there's nothing wrong with you. Maybe it's in your head, or the sometimes the go-to, which is not a great go-to, before ruling out some of those other things I've talked about, is, well, you're depressed. You meet the requirements for depression. So let's put you on a medication that can help with depression. Often an SSRI or an SNRI to help increase your serotonin. And, if it's an SNRI, norepinephrine, and that can definitely work. And I think that's something to consider after you have ruled out the others: a hormone imbalance, a nutrition issue, sleep, those things, thyroid, which is hormone, those things I think need to be ruled out beforehand for sure.